Back today is Dr. Devin Oller. He's a primary care and addiction medicine fellow, and he served as one of the first rural health leadership fellows at the chief resident at the Massachusetts General Hospital before coming to UK. He's an associate program director of the University of Kentucky Internal Medicine Residency Program and an investigator for the NIH-funded Healing Community Study. Welcome back, Dr. Oller.
So similar to last week, our practice gaps and needs are to demonstrate that motivational interviewing is a proven evidence-based approach to promote behavior change, but how we best implement it is not really well known. So really it's about trying to target the specific patients that you're seeing and their cases. And so we're going to talk a little bit more about that today. And we hope that some of these skills can help clinicians, social workers, peers, and others promote behavior change. I'm going to review at the start of the presentation some strategies and skills for motivational interviewing, but a lot of this is going to be practiced. And we'll talk a little bit about how best you can integrate this into your existing workflows at your job. I hope that you come away with those skills and strategies and can really strengthen your client's motivation for change. So before I jump into strategies and skills here, I would love to just go ahead and throw in the chat maybe one or two things that you're hoping to practice today, things that you want to learn a little bit more about within the motivational interviewing realm. So I'm going to start reading some. I know I want to make sure that folks have time to chat, put that in the chat, but absolutely, the open-ended questions can be tough, and I'll combine that with what Andy is saying is like trying to make those questions natural sounding as much as possible and work with the overall flow of the conversation. Chris mentions developing discrepancy, right? So that's one of our overarching strategies to help with folks who might be ambivalent about changing their current behavior. And so how to do that in a non-judgmental and supportive way. And Shannon says, getting them to answer more open-ended questions, right? And I think that can be a challenge, right? Especially folks who might be fairly ambivalent about even talking with you, trying to find a connection or something to get more out of them is one thing that we'll talk about a little bit later. So thanks for those. And certainly I'll watch the chat as well if others come in, but I'll try to focus on those things moving forward in addition to some of the exercises that we have planned. So the strategies that we're using, should look familiar from last week, but expressing empathy is probably our biggest one, right? And often what I find is a good reset when things are starting to get a little bit heated or they're getting uncomfortable with where the conversation is. Expressing some empathy can be a huge way to draw them back into the conversation. Communicating respect and acceptance, right? Establishing non-judgmental collaborative relationship and not necessarily expecting that in the first visit with a client, right? I often tell my patients, I recognize that you are trusting a lot of me by sharing some of this information. And I really appreciate that. And I only hope to earn some of that trust back, but I know I have a long way to go. Even just sort of sharing that with the client can help things feel a little bit more equal on both sides. Try to be supportive and knowledgeable consultant, right? Instead of saying, let me tell you about this particular medication, inviting them into that conversation. Would it be okay if we spend a little bit of time talking together about Suboxone or methadone, right? Listen rather than tell. I'm not demonstrating that very well right now, but this is a presentation. But when you are in the conversation with the client, trying to make sure that you are listening more than speaking can be huge. We already mentioned developing discrepancy. Ambivalence is a normal part of behavior change. That should be your mantra. And it is also normal to feel uncomfortable moving to either direction from ambivalence. We want to try to avoid argument at all costs, roll with resistance, not ignoring resistance, but making sure that we're not putting that client in the position of arguing against positive change, and supporting self-efficacy and optimism, often through using some affirmations, which we'll talk about shortly. Okay, and then we talked about the skills, which are your oars, right? So you're in the boat with the client. They get to decide which direction they're going in, but you're giving them these tools to help figure out their motivation and their direction. And that's open-ended questions, affirmations, reflections, and summary statements. Open-ended questions are often the way that we start conversations or start discussing specific topics, and they can't be answered with a single word or phrase. Affirmations support and comment on the strengths and motivation and the positive intentions of clients. Too often in these conversations or in prior conversations when folks have worked with the healthcare industry in general, all they feel is negative, right? You have these negative consequences of your use. The only way to make things better is to completely change who you are and what you're doing, right? But some of who they are is the way that they are going to get into recovery and remission. Reflections demonstrate that you are listening to them and making sure that they feel understood and heard and safe above all. And then summarizing allows you to make sure that the client is hearing their own change talk, the things that are motivating them to make a change, while also sometimes if they are expressing resistance, allows you to sort of transition to a different topic where there might be less resistance. We're going to dive deep into change talk versus sustain talk. So I wanted to spend a few minutes talking a little bit about the differences here. And basically change talk is any comment from the client that you're working with that suggests that there's a motivation to make a change in their life. And that can be anything from a desire or a reason to change to, commitment to change or sort of an external need that is sort of put on them to change. Regardless, these are really important things that when we're hearing, we want to try to jump on and draw a little bit more out from the client. We equally want to be listening for sustained talk, right? And again, trying to avoid an argument with the client, but seeing how much they really believe statements like what you see on the right side. So I talked a little bit about this on the last slide, but we can separate change talk into a couple different categories. Desire statements are often starting with I want to or I wish, or it'd really be nice if, right? And then they say, if I could maybe reduce my use a little bit, or I could only use on the weekends, right? Reason is those things that are motivating them. I think that's really powerful change talk when they're talking about friends, family, others who have brought up concerns, right? And they hear those concerns, but it's hard sometimes to make that initial step. Commitment, this is often in folks who are a little bit, they're moving through that ambivalence and ready to make a change. And so it's about reinforcing that commitment while demonstrating to the client that they have a lot of power to make that change, which they don't always see. And so those are times when affirmation or summary statements can be really helpful. Ability, they're expressing that it's possible for them to make a change, right? Even if it feels far-fetched to them, you want to try to dive in and understand that ability a little bit more. And then need, again, is typically something external, where they feel like a doctor, a family member, a friend is sort of saying that something needs to happen. And they acknowledge that, right? And even acknowledging that is a potential starting point for discussing change. 3 great open-ended questions to ask whenever you're hearing this change talk. So for an exercise later, if you guys want to copy these down, this is going to help you out. Where does that leave you, right? or where does that leave us, right? If we want to think of sort of a collective decision making that we're doing, where do we go from here, right? What do you think you will do? All of those sort of allows them to generate what might be some next steps to either address that change or enhance their motivation, or actually commit to making a change. So where does that leave us? Where do we want to go from here? What do you think you will do? Great questions to respond to that change talk. Okay, we're going to jump right into exercises. But before we do that, any questions about either the general strategies or the specific skills, the ORs that we use in motivational interviewing? And I'm just looking at the chat here. Courtney, thanks for adding that in, sort of off of our initial conversation about gaps or other needs that you have, saying, I'd like to know how to work with someone who is opposed to make any change currently, right? So we will get to that, I promise. I find that those are the clients that I want to do motivational interviewing the most with, but I also have to accept that the outcome of that conversation might be something very different from what my goals are for that person. And so we often have to check our own goals at the door when having conversations with folks who are deeply ambivalent about any change. Okay. All right, without any more questions, let's go ahead and move forward. Okay, so get your keyboards ready. We're going to practice some affirmations. I'd like you guys to pick one of these. So I'm giving you 4 options to respond to. I'd like you to pick one of these and come up with an affirmation, something that allows you to share or reflect on a strength, something that somebody's working really hard on, acknowledging effort, whatever you feel most comfortable sort of affirming. Go ahead and type out how you would respond to some of these statements from the client with a positive affirmation. So the first one is a client shares with you that it's been 3 weeks since they used any meth. A client reports to you that they continue to insufflate or snort heroin or fentanyl, but stopped injecting this week. A client lets you know that they reversed an overdose of a close friend of theirs. Client says that they've been struggling a lot with missing their kids around the holidays. They lost custody about a year ago due to ongoing substance use. So again, take a few minutes, and then we're going to compare some of the different strategies that you guys use in coming up with these affirmations. Just warming up the fingers. Okay, so I'm going to start reading them out as they're coming in. So Shannon says, I'm happy you were there to save your friend. I know they mean a lot to you. So this is responding to the overdose, right? And sort of the main thing that you're acknowledging here is that that person really was doing their best to save a friend. That's great. Courtney, I want to acknowledge a little bit of a difference here with Courtney's approach versus Shannon. So Courtney says, you are doing a great job taking steps to regain custody of your children. I see how much you miss them, and I'm sorry you're experiencing this pain right now. So what I really like there is the you statement, right? So affirmations tend to hit a little bit better when we're using sort of you statements versus I statements, right? But you can also combine it like Courtney does, where she says, you are doing a great job, and also acknowledging I see, right? Or I hear just how tough it is for you missing them right now. 3 weeks is a big accomplishment. You're doing great, right? So good you statements. And then I love sort of the amplification, right? They might be saying this just as sort of a passing thing. It's been 3 weeks since I used any meth, right? But that might actually be a really big jump that they made. and something that we want to explore. And so being able to use sort of that amplifying adjective, like big accomplishment, I think is really nicely done. Samantha is also responding to the first one. That is amazing that you haven't used any meth in 3 weeks. That is a huge accomplishment. Huge, big. Love the adjectives, looking good. Congrats on your sobriety, says Tasha. What an accomplishment, right? So that's great. And just you saved someone's life, keeping it super simple, right? And you might pair that with an open-ended question to ask them to reflect a little bit on that. You saved someone's life. How'd that feel? And that might generate some more motivation for them to make positive changes. Ray says it must make you feel so accomplished to have gone through 3 weeks without meth use, right? So good use of you statements. And Daniel's sort of using the I hear or I see statement to acknowledge how they're doing. And that's sort of almost like a two-sided reflection. Good. And expressing some pride, right? So awesome job, guys. So a couple of key takeaways here is when doing affirmations, this, like with reflections, simpler is better. Starting with a you statement. You are an amazing friend for being there and helping to reverse an overdose. You must feel amazing that we've been able to go that long. That's such a accomplishment, right? You made a really amazing decision to stop injecting. So all of that is great. And then using sort of those amplifying words when folks might have a tendency to minimize their accomplishments. And we know that clients do struggle with the things that they're good at. So being able to acknowledge that can be great. Okay, so use affirmations. It's a great way to dive a little bit deeper into their own strengths and things that we can tap into to make positive behavior change. And thanks for jumping in the chat. Okay, I love the readiness scale. This is probably my #1 motivational interviewing tool that I use on a regular basis. So when thinking about, what things can I use on a day-to-day basis with the clients that I'm working with, I think near the top is the readiness scale, right? And it can be a pretty straightforward approach where you're near the start of an appointment, sort of introducing the topic of, hey, I would love to chat a little bit about your alcohol use. Would that be okay? Right. So inviting them into the conversation. And then starting out just with, when you think about reducing or stopping your alcohol use on a scale from 0 being not at all ready to 10 being ready right now to make a change, where are you at? Right. And you can draw that out for them. You can just get it verbally if you're talking with them on the phone, but getting a number is really important. So what I want you to do right now, this can be fun. I want you to think about something that you're trying to change in your life, right? So for me, it might be, taking the trash out more frequently. That would be great. I think it would help the whole household if I was doing that a little bit more. And sort of see where you're at on your readiness scale, and then come up with 1 or 2 follow-up questions that you would have for yourself based on where you're at on that scale, right? So for me, I'm like a 5 on the readiness scale. And so I might ask, what would get us to maybe a 6 on that readiness scale? So that's what I'm asking you guys to think about, is something that you're looking to change in your life, where you're at on that readiness scale, and maybe 1 or 2 follow-up questions. And if you feel comfortable sharing, you can put those in the chat. If not, I'll give you a few minutes to reflect on that, and then maybe we'll discuss together at least those follow-up questions. Okay, so we're starting to get a few answers in here. So Daniel says, so yeah, that's a really tough one, Daniel, of trying to check our prejudice and how our own experiences might impact how we view clients and what they're going through. I'm not sure what just happened with my screen here. Give me a second to figure this out. Yeah, and so you had a good follow-up question of how, basically like how satisfied or how do you feel about where you're at right now, right? That's a great one because they might be feeling really proud about being at that number, even though you might not see it that way. And that's a great way to check some of our prejudice or preconceived notions about this client. So I think that's a really good point. What changes can we make to not sacrifice quality over quantity? Okay, like that. What changes could we make right now? And we could even say, like, short of reducing our drinking or stopping our drinking, right? What other follow-up questions do you guys come up with? And you guys can unmute if you'd like to share that way too. So, oh, Chris, coming through. What can I do to move to up to 7 or 8? Good. What is the first step I can commit to achieve that goal, right? So especially for folks who are on the right side of that readiness scale, what's the first step can be a great way to jump into trying to get some commitments from the client. So all those are really excellent, and thanks for sharing. I'm gonna go ahead and clear, and we'll move on and talk about some of the ones that I use. So like I said, you want to introduce the scale. You don't want to just give them that scale and say, where are you, right? You want to say, okay, when we think about your substance use, whether that's alcohol use or heroin use or cocaine use, and we think about reducing or stopping use, where are we at from 0 being not at all ready to 10 being ready right now to make a change? And then you see where they're at. But one thing that you can do instead of that is ask about importance, right? So 0 being it's not at all important right now to reduce my drinking, to 10 being it's the most important thing in my life right now, right? It allows you to then pick up on maybe some other priorities that the client has that we haven't had a chance to address. So that's one variation of this. We talked about sort of what would increase that number by 1, what would get us from a 6 to a 7, right? Or a 7 to 8. But it's equally important to ask, why isn't it lower, right? So by asking, hey, I see that you're at a 5 right now. Why is that not a 3, right? That's going to elicit some positive motivation, right? So they might say in response to that, well, my health is really bad. I just got admitted with, inflammation of the liver from drinking. So I know that something needs to happen because I only have one liver, right? Where do you think your spouse, significant other, best friend, whoever somebody is really important in their life thinks about this, right? And that helps with 2 things. It lets you know who's important and who's helping influence some of these really challenging decisions. But it's also allowing you to pick up on the discrepancy, right? If a spouse or significant other is higher on that scale, you can ask that natural follow-up question of why do you think their number is different than yours, right? And that's sort of a non, I guess, judgmental and non aggressive way to sort of think through why there's differences there. I love the have you been higher or lower on this scale in the past, right? Because often things that might have influenced that number in the past are probably still present, right? Family issues, legal issues, social issues, medical issues that are driving some of the negative consequences of use, and potentially pushing somebody higher on that scale. Knowing about whether those were past issues can be helpful in deciding whether they're current motivators for them. Asking about other substances, right? So I hear that we're around a 5 when it comes to alcohol. Where are you at in terms of cigarettes, right? And then differentiating the motivators for that other substance compared to the first substance that we talk about. And when you're having these conversations with clients, you can always sort of bookmark things and tell them, hey, when we check back in, I'm going to ask you where you're at on this scale again, right? And when you have that follow-up appointment with them, you can say, hey, last time you were a 5, where do you think you are today, right? What changed, right? About your view of things, or maybe other people's views, or complications from use. So you can see how quickly this small exercise can expand out and encompass a ton of great information that's going to help you help your client. And so I find it's a great one to start with, to open that conversation, and use some of these add-ons to really get to the nitty-gritty of why there might be ambivalence about reducing or stopping use, or for folks who are on the right-hand side of the scale, a 7, 8, or 9, really begin to see what the barriers are getting in the way of making that commitment in the next step. Any questions about the readiness scale? Okay, cool. Use it. It's really helpful. And we brought up this a little bit earlier. Someone had said, I'm trying to look back here. Yeah, so Courtney had said, I'd like to know how to work with somebody who is opposed to make any change, right? So people who are on the lower end of that scale, a 1, a 2, a 3, right? Even a 0, right? And sometimes I joke that even if somebody chooses a 0, right, you can ask the question of why not a -1, right? Why not even lower number? As a way of potentially generating some of that positive motivation to make a change. But another way to approach this is just to acknowledge that change is really hard, and ambivalence is a natural state that most humans are in. And that some people in that state of ambivalence or low readiness might be falling into some of these categories, right? When it comes to their substance use. And we want to have slightly different responses based on which sort of category they fall into. So reveling. Are folks who are still very focused on the good experiences about substance use and have not necessarily experienced many substance use related negative consequences. I think of sort of our younger clients, or our clients who are using in a binge pattern, where there's long stretches in between of them living their lives and not having significant issues related to their substance use, and still finding a lot of good from the substance use itself. So how do we approach that group? Well, providing some objective or non-judgmental feedback about their substance use, inviting them into a conversation about potential risks can raise a little bit of doubt about their ability to avoid negative effects of the substance use on their life. Sometimes too, I think about if the good experiences are relief of pain symptoms or mood symptoms, I'm really honest with clients and say, fill in the blank drug, whether it's alcohol or heroin. I don't have a drug in my arsenal as a doctor that works as well as heroin or Xanax or cocaine when it comes to making you feel better quicker. But those sort of experiences are often short-lived, right? And the reason that we don't have those drugs is that if we created those drugs, they would have too many of those negative consequences. So those are our folks who are in that reveling category. Reluctance. Clients lack knowledge about the dimensions of the problem or the personal impact it can have to think change is necessary. What are some things that we might do to help those folks? I think of clients who have developed some consequences or complications from their use, but have been using for a really long time. They're survivors, like they've got through a lot, right? And so there's this inertia that happens. And so these are folks who respond again to non-judgmental feedback about how it might be impacting their lives. I often search to see if there's other domains that we haven't addressed, whether that's we focus just on the legal issues and not some of the medical or social issues, or vice versa. And they also respond to reassurance that they will be able to function without the addictive behavior, right? So if we remove this thing that's really helping with your back pain, are there other options that are going to help with your back pain? Maybe not equally, but enough where you feel like you are in control again, right? Going through these other ones quickly. So rebellion. Clients are often afraid of losing control over their lives and have a large investment in their substance use. Who has seen clients like this, right? I think all of us have. And so our challenge is to help them make more positive choices for themselves and see that by making those positive choices, they actually get more control over their life. And releasing some of that pressure to make a change. So emphasizing personal choice and responsibility can work well with them. I think we've also seen a lot of folks in that resignation category where they feel hopeless or helpless or overwhelmed by just the level of activation energy required to make that change. Or they've been in this number of residential programs, IOPs. It feels like nothing is working, right? And so what's helpful here is those affirmations, trying to inject more hope and optimism into the picture, exploring specific barriers, things that they didn't like about prior treatment attempts or change attempts, but also the small successes that they might not have noticed as a result of those treatment attempts can be huge. And then rationalization. This is sort of like our smarty pants category, where they think they have all the answers and that substance use may be a problem for others, but not for them, right? And that's where some double-sided reflection can be helpful. They are itching for an argument. They want to have an argument about their use. And so if we can deprive them of jumping into an argument, that can be really helpful, right? And reflections are going to be, and open-ended questions are going to be your go-to with that group. The other thing that we can do, and I find this to be really helpful as well, is our agenda map, right? So oftentimes when I am working with clients and they're a 1 or a 2 or a 3 on that readiness scale, I might just step back and say, I think I might be missing something, right? I want to try to understand a little bit better what your priorities are, why you're here, right? And chatting with me. So let's actually work together and figure out what are the things that we want to try to address together, right? And you can use these sort of open boxes on a piece of paper to help map out what are their priorities, right? I always try to leave like one box open so that I can actually put substance use in there. But I'll often just with the client say, okay, shout out a few areas of your life that you feel like need improving, right? So to this group that we're working with today, maybe put in the chat, like what are a few other domains that you feel like clients often bring up when you're sort of giving them free rein to discuss their agenda or their priorities. So I'll do one like transportation, right? Run into that all the time. What else? Legal, yeah. ID, employment, housing. Talked earlier about sort of like pain or like mood issues. Anything else? Yeah, so like friends, social network. We've all been in that situation where a client just really wants to like dish on the latest gossip about friends, right? But it's often reflective of like not having a lot of other people in their social network to share those concerns. And childcare, I think, is a great one, and one that we ignore sometimes, right? So once we have sort of these things out here of, okay, now I have a better sense, you can share with the client, now I have a better sense of the things that are really important to you, right? And so maybe like what one or two things do you want to make sure that we address today? And I'll like, and they might say like housing and job stuff, right? And also put stars next to those and say, okay, let's dive into that, right? And try to get a little bit more about the housing. But the key here is we want to try to bring it back to the substance use, right? So we've spent a little bit of time talking about the barriers to housing. Do you see your current level of meth use or heroin use as impacting any of those barriers, right? So it's a sort of reverse way of getting to what other motivations that they might have to make a change with respect to their substance use. Hopefully that's helpful to see. Okay, I'm gonna go ahead and clear these. Okay, so I promised that at some point we would talk a little bit about change talk and sustained talk. And so what I'm going to do is I have a couple of brief like back and forth dialogues between a client and the person that they're working with. And what I want you to do is just try to focus on maybe one phrase that you heard that represents change talk, right? Go ahead and type that out when you hear it in the chat box. And then once we're done with the back and forth paragraph, then go ahead, we'll say, okay, everybody hit enter, and we'll see sort of what responses that we got, okay? And be ready, I might call on you to think about how you might respond to that specific change talk that you hear, okay? So we're gonna do this 2 times. And so I'll read out the back and forth between the client and the person that they're working with. And I want you to try to focus on what change talk is being shared and type down the phrase that you heard that represents change talk. Pull up my script here. Okay, so here's the patient. The patient is saying, I've been chasing heroin for as long as I can remember. I know I would be better without it, but I can't stop. There are some days where I keep asking myself, what am I doing, even in the middle of injecting? I wish it wasn't this way. I really do. Maybe I could use less. I'm not sure. I feel that when I've tried that in the past, I still feel terrible physically. I'm definitely thinking about stopping though. I have to. If I wasn't thinking about stopping, then I would be crazy, right? Because I know I'm killing myself. I don't want that. But I've been chasing for so long, I fear what happens when I stop. So I threw a lot at you. Hopefully we picked up on a couple of phrases there. So Andy brings up better without it, right? Good. There are days I keep asking myself, what am I doing? Maybe I could use less. Good. I know I would be better without it. I wish it wasn't this way. I'm definitely thinking about stopping. I have to. You can see this client even sort of going through different forms of change talk within this same like 30 seconds of dialogue, right? So jumping into it a little bit more. So when the client says, I know I would be better without it, right? But I can't stop. How might we respond to that? And you can type it in or you can unmute and share how you would respond to that. They say, I know I would be better without it. That's change talk, right? But I can't stop. How would you be better? Love it. So good open-ended question. What leads you to believe you can't stop, right? And they might bring up some of those issues with like withdrawal symptoms. They said, I still feel terrible physically when they tried to cut back, but that's a helpful barrier, right? To then maybe invite them into a conversation about medications that might be helpful for the withdrawal. What would your life look like if you stop? I love that, right? You're starting to get them less focused on the here and now and more on in the long term, where do you want to be, right? We talked about this earlier, but a great open-ended question that we can use for almost any change talk we hear is, where do you want to go next, right? Or what do we want to do about that, right? So I think that's really good. Let's pick out maybe one other change talk and think about how we would respond to it. So when the client says, I'm definitely thinking about stopping though, I have to. How would we respond to that statement? I'm definitely thinking about stopping, I have to. Because that's a different type of change talk. I have to is going to be more of the need type of change talk. And we might have to have a slightly different approach when they're expressing that need, which is often an external thing, right? So how might we respond to, I'm definitely thinking about stopping, I have to. Love it, Daniel. We're breaking out the readiness scale, right? Right, because it feels like this is a chance to explore a little bit more that statement, I have to, but I want to know where they are at, right? They have this feeling that that other people probably want them to make a change, but what do they feel? Courtney, I like that too, right? Because what that's addressing is probably some of the fears or some of the concerns that they have about reducing use. Andy, I think that's also a good open-ended question. Why do you have to, right? What sort of pressures are you feeling? And I think sometimes being really direct in addressing some of those concerns that they have allows you to anticipate some of the things that might be able to help them. So all those are really, really good, guys. So let's try this one more time. We're going to do one more scenario. And it's not even about substances. But I want you to listen for change talk and be ready to put an example or two in the chat based on what you're hearing, okay? Okay, so this is the second scenario. I think about my weight a lot. It's always on my mind. Sometimes I think it would be nice to lose some weight, sure. And I've lost weight before, don't get me wrong. I don't think it's impossible. We talked a lot about my health issues today. I have pain in my joints, I have sleep apnea, I have stomach acid. Those might get better if I lose some weight, right? I have a few friends who are going to the gym. I could get a membership in the new year when there are some deals and stuff. I know reducing carbs is going to be tougher though. For me, there's nothing better than a big bagel to start my day or a deli sandwich for lunch. I'm a sucker for pasta too. I sound like a glutton, don't I? But I'm going to tell you this because I don't even like it. I can cut out soda. I can definitely do that. I'm not a huge fan of following some fad diet though. Those always make my weight yo-yo up and down. It's like if it was supposed to be easy, then everyone would do it. This is hard. Doesn't mean I shouldn't try. What do you think? Maybe start with exercise? So what are some examples of change talk that we heard there? Yeah, so John brings up I could get a membership too, right? So they're talking about getting into the gym. Daniel's already jumping to sort of how they would respond to that, which is good. Samantha says, sometimes I think it would be nice to lose some weight, right? So that's more of that like desire type of change talk that we're hearing. I'll feel better, right? But often we hear that a lot. And that's more of a reason type of change talk, right? So you can see how even on that second go through, you guys were a little bit more attuned to, okay, I'm hearing some change talk. I'm even hearing some more subtle type of change talk, right? Like desire, reasons to change. And that helps immensely as you're listening to your own clients, to be able to jump in and ask some open-ended questions or reflections targeting that specific change talk. So let's do one more. Let's pick out one of the change talk phrases and think about how we would respond to it, right? So when they say, I could get a membership in the new year when there are deals and stuff, so that's like commitment type of change talk. So actually, it's more of a ability, right? I could get a membership. They're not saying I'm going to get a membership in the new year, right? I could get a membership. So how would we address that ability type of change talk? I could get a membership. And Courtney, I want to come back to your comment. I just want to see what folks, I think that's really good. So I think that you guys are targeting the membership question well. One other approach that you could take is asking about what Courtney brings up, right? So asking about what they would look forward to about having that gym membership, like what did they enjoy doing, right? And being able to celebrate and instill some hope and optimism that doing those activities that they really like doing may actually help their health as well. But I can't ignore the fact that the point that Courtney made a little bit earlier of, sometimes when we're listening really intently for a change talk, and trying to like latch onto that as an opportunity to get them moving in the right direction, we can sometimes ignore the most important skill in all of motivational interviewing, which is like expressing empathy, right? And this might be somebody, whether it's weight or substance use, who is really, really hard on themselves. And so sharing those, sort of interrupting that with affirmations, right? Or using a simple reflection to acknowledge the hard work that they're doing, can be really, really helpful in the moment, maybe more so than trying to jump in and address that change talk. So I appreciate you bringing that up. And that's so critically important. Awesome. Well, thanks, guys. Let's go ahead and move on. Just clearing some things out. Okay. Let's see how much time we have. Okay, so let's talk about this exercise. So this is another favorite of mine when I'm doing some motivational interviewing with clients. And this may be, I am a huge proponent of not having the whole chunk of your conversation with a client being motivational interviewing, because sometimes it does feel fake and sometimes it doesn't feel authentic. And you want to connect with your clients because that's the biggest predictor of them continuing that conversation. But one nice way of combining something that we do naturally, just as human beings, and some motivational interviewing is an envisioning. And the way that I'll start this is I'll draw sort of this picture on the middle of a blank piece of paper, right? And I'll say, this is you to the client, right? This is you in 3 months from now, or 6 months from now, or a year from now, right? What does your life look like? And begin to sort of sculpt what their ideal would look like a few months from now or a year from now. And so what are some things that you imagine clients sort of bringing up as you're doing some of this envisioning? Some goals or some objectives that they might have. I'll put one in here, like new job, right? A lot of our folks are struggling with just really tough jobs, right? Where they don't feel like they have a lot of time for themselves. Right. So like reconnecting with kids, that might look like different things to different people, but I think that's a huge one. Self-reliant. I can type. Housing. That's great. Sometimes I'll even draw out like, what do they want their floor plan to look like really specific stuff, so that they have this really clear image of what life might look like. Insurance. I would add like financial stability, right? Right. Thank you, Dan. So, and recovery, right? And and some folks might include recovery in there, or remission of their opioid use disorder in there, and others might not. And then that becomes an opportunity to say, hey, does a recovery or remission of your opioid use disorder, like where does that fit in here, right? Does it fit in there? Do you see that as an important part of achieving some of these things that you're looking for? Or is that lower down on your priority list? But similar to the agenda setting, like the agenda map at the start of a conversation, this is a great way near the end of a conversation with a client to really be able to dig down and say, okay, with these big picture goals in mind, what do we want to work on right now to start moving in that direction, right? So you take this global picture of somebody optimistic, happy, in control, right? And you say, how do we start moving in that direction? And it's a great way to begin making maybe even small changes towards recovery. So let's go ahead and end with a case here. So I really want us to sort of think about how we would be approaching this patient or this client. If they were yours, how you might use some motivational interviewing to help them. So we're going to brainstorm together some ideas. So BA is a 40-year-old male. He has opioid and methamphetamine use disorder. He's experienced several overdoses in the last year and was started on buprenorphine after his last overdose in May. It's now December. After missing several appointments in June, he did not return to his clinic, right? So he's not been seen since around June. He reports to you that he's returned to daily IV fentanyl use and methamphetamine use. Okay, so go ahead and throw in the chat maybe one or two exercises that you would focus on in this first follow-up with this client in basically 6 months, right? He's returned to some active IV heroin and methamphetamine use. He's previously been engaged in treatment, right? So what are some things that we would want to make sure we cover? Maybe an exercise or two, or what would you focus on? So John's jumping to pretty specific, right? So just starting with an open-ended question of how have your relationships changed since your return to use, right? So yeah, I think you can certainly you preface that by saying, I just want to check in on all the things that can impact your health and well-being, and relationships is a big one, right? So how have those relationships changed in the last few months? So Candy, similar, right? So how's your return to use affected your daily life? I really love talking to clients or patients about what a typical day looks like. It's a great way of setting the scene, of being able to empathize with them, with some of the challenges that they're facing, just getting through their day. And it gives you really important clinical information that might be helpful later on. So sort of jumping in with, tell me what things have been looking like over the last few days is a great way to jump into it. Courtney says, I would focus on identifying and celebrating the length of time you use buprenorphine successfully, right? So introducing to the client, I know we were on buprenorphine for a period of time earlier in the year. Tell me about something that you liked about that, right? And you would want to ask the other side of things too, right? Anything that you didn't like, right? Anything that got in the way of treatment, because you want to be able to anticipate those. But starting with the positives and celebrating those positives would be great. Daniel, jump into what can I do for you right now to help, right? And I think you would want to couple that with a reflection statement of, I hear that this is a struggle right now. Things are hard, right? What can I do to help you right now? Would be a good sort of motivational interviewing tactic there. Courtney says I might ask about what they're seeing as the benefits, right, of returning back to heroin or fentanyl use, right? We had this period without using, right? And there were probably some triggers or some things that pushed them to use. Affirmations. So Daniel brings up CBA. That's a cost benefit analysis, right? Or generating a pro and con list. And then the motivational interviewing part of that is using like summary statements at the end of it to emphasize the things that are going to tap into their strengths moving forward, and acknowledge some of the barriers that they might be facing. And Candy, I think that's a great thing to start with too, is I am so glad you're here, right? I really want to congratulate you on making the choice to continue this conversation and figure out together what might be helpful moving forward. So that's absolutely probably where I would start, is that really positive, that really hopeful, that really optimistic affirmation jumping into this, right? Because this is hard from the client standpoint of struggling and asking for help again after a period of not asking for help. Awesome. So very quickly, some things that can be helpful when folks are returning after a slip or a return to use from a motivational interviewing standpoint. Understanding sort of the cognitive traps that they might be falling into. So that's like black and white thinking. And the example that I give is like for my patients who are coming to my clinic for Suboxone, is they might have a slip and say, this is it, like I can't do this anymore. This is too much. And I talk about how they had one slip over the last week, right? And if a basketball player shot 6 of 7 from the field, their coach would not be giving them a hard time. They would be celebrating the fact that they did pretty well, right? So I think acknowledging those pauses of, you had 6 out of 7 days where you did not use, so we're doing something right. Let's try to focus on that. Temptations, so similar to triggers or things that might be tempting them to use, we'll want to explore that and understand those as well. Replacement activities, that's basically the things that they were using the substance for before, helping with mood, helping with sleep, helping with pain. How are they managing that? What other activities are they doing? Is it meditation? Is it connecting with their spirituality, getting to church? Understanding those replacement activities and celebrating their attempts to use those, that's going to help prevent further relapse. Preparations for return to use, right? So this might seem counterintuitive, right? But actually talking through and envisioning, okay, we have a slip again this coming week. What do we think that's going to look like, right? What do we think would have triggered it? How can we make sure that we're being safe if we do have a return to use? Because that allows you to tap into some of their strengths, right? Of trying to think about use safely, some of the harm reduction tools that they're already using. And then lastly, sort of strategies for coping, right? If they're feeling strong emotional or physical symptoms in the coming week, what are we going to do, right? Are we going to tap into some of their mindfulness activities or meditation? Are we going to make sure that they have urgent care or doctors that they can call? if there's new issues that can be addressed with other medication or other interventions. So talking through those can be really important. So we want to educate on the cognitive traps that they're falling into, evaluate for interpretations, for temptations that they're dealing with, encourage them to use those replacement activities, empathize with the fact that slips or returns of use are hard, but we can get through it, and elicit some of those strategies for coping that they might feel comfortable trying out. So just to summarize here, there are many strategies that make for successful MI. The biggest one is just accepting that ambivalence is a part of day-to-day life. We feel it all the time in small ways. Our clients often feel it in really big ways. And being okay with a little bit of discomfort is often our biggest task in working with them and working towards those positive changes. ORS is our great mnemonic for the skills that we need to be using when navigating those MI conversations. If you find yourself in teaching mode, so what I'm doing right now, go back to those ORs, and that will help you immensely. And we want to make sure that we're evoking and highlighting and supporting change talk in the way that you guys practice today. And lastly, if you're arguing with the client, stop and check those assumptions, that prejudice at the door. We will get them where we need to, but they have to discover that that's a solution to their problems first. So helping them along the way and through that ambivalence can be critical.